Hi, and welcome to Nursing Pharmacology with Chippewa Valley Technical College. This PowerPoint lecture is going to overview the course of Nursing Pharmacology, which is required in your first semester of the nursing program. So let's talk about the course expectations. First of all, CVTC has 4 core abilities. And the core abilities include communicating effectively, model integrity, think critically, and value diversity. If you look at those 4 core abilities, hopefully you're thinking that that's how you'd want an RN to also demonstrate his or her behaviors. Also in this course, you really should be accountable for your own learning. So come prepared for class, and that means doing the readings or viewing the lectures ahead of time. It's optional to print lectures and bring to class, but it can be helpful because you might want to fill in some additional information that we discuss. Actively participating in any class activities has been very helpful for students in the past. If you come in not really willing to participate, that puts up a barrier to your learning, and then you might not get as much out of the activities as you could. Finally, do for yourself what you can do for yourself. Okay, so you're entering a profession, so you really need to think critically about how you can get information that you're seeking. So what does that mean? So if you have a question about any kind of course content, you really should first try to look at all the resources that have been given you, including your text, the PowerPoints, any in-class activities, and so forth. Maybe you want to discuss some information with a peer to see if they understand the material. And then finally, if you still can't find it, please contact me. But do keep in mind, I typically will respond with another question. Okay, so if you just email and ask, what is such and such, I'm going to probably respond back in a question that is going to increase your critical thinking. And then hopefully you'll send me a reply when you've found the answer, and then I will confirm it. So this course is what we call a flipped classroom, meaning it's not like your traditional, let's sit in lecture for 2 hours and I just talk at you, okay? So that would be very boring, right, for both you and myself. So during class, when you're there, we're going to be doing a lot more activities. Okay, so we'll be evaluating and analyzing the information for this course. We'll be applying it to certain activities such as case studies. So then outside of class, you need to really work on understanding what is the content and then trying to remember and recall that. So let's talk about how we actually learn. So maybe you've heard, my learning technique is reading, or I'm a visual person, or I need to hear it, see it, and then do it. Okay, so we all kind of learn differently. But what has been found in research is that just sitting in a classroom and hearing a lecture, only about 5% of that information is actually retained. Okay, so I want you to think about that for a second. Do you think I'm going to just sit there for 2 hours and lecture at you? Probably not, right? No, I'm not going to. So if you can kind of look at the pyramid here, down at the bottom, at the base of the pyramid, the most effective way we retain information is by teaching others. And if you think about the nursing profession, we're doing a lot of teaching. Okay, so in this course, we're going to be learning content and teaching each other different information. We'll practice with content and so forth. We'll have discussions, okay? It doesn't mean we won't have any lecture in the class, but do note that the majority of the class is not going to be based off of lecture. So struggling means you are learning. Okay, so this is your first semester in the nursing program, and many of you might have concerns and anxieties about how challenging this course or program can be. Okay, and so the nursing program is rigorous, but just because you're struggling, that doesn't mean you aren't learning. Struggling actually means that you are learning, okay? So try not to get frustrated when you don't understand a concept, okay? Think about strategies of how you could better understand it, okay? Think about a time in your life when you've struggled. Okay, so hopefully you've all maybe thought of something in the past in which you've struggled, and what kind of things did you do to overcome that struggle? And then ultimately, hopefully you learned from that experience, okay? And that's what I would like you to do in this class as well, okay? So just keep in mind, if you're struggling, try not to get frustrating. That really actually means you're learning this information, okay? Let's also talk about changing our mindset, okay? So there's something known as a fixed mindset versus a growth mindset. So fixed mindset means, an example could be, I'm just not a good test taker, and that's your response after maybe you don't do as well as you'd like on an exam. Okay, but a growth mindset would say, I really didn't do as well on this exam as I would have liked, but I know I can do better. And how I'm going to do better is what? X, Y, Z. Okay, so try to think about this course and all of your courses in a growth mindset. So I want you guys to take a look at the course syllabus, and that's found in our learning management system. Basically, the course syllabus is a course contract. It contains our college policies, the nursing program policies, important exam policies, and grading information. So I really want you guys to make sure you look at the syllabus and really look at specific things about the nursing program, examine exam policies and assignment policies and the grading information. Do note that in this course, you have to achieve an 80% or higher to pass this class, okay? And we do not round our grades. So if you end up with a 79.5% in this class, that will not round up to an 80%, okay? So you need at least an 80% or higher. And just back to the exams, when you're reviewing the course syllabus, note that the majority of your grade is based off of our exams. This is a weighted course. So about 90% of your course grade comes off of your exams. You also have course objectives that are found in the learning management system, and I want you guys to look at all of those. The course objectives are broken down by unit. And how do we come up with these course objectives? Well, they're based off of a variety of different resources. So different resources we use to compile our course objectives include information from the Wisconsin Board of Nursing, the NCLEX test plan, which at the end of the program, in order to actually obtain your RN license, you need to pass your NCLEX exam. We also base our objectives off of National Patient Safety Goals, Healthy People 2020, and there's a whole list in the syllabus as well. Okay, so the objectives really should guide your learning and studying in this course. No study guide is given in this course, so this is a really good document to kind of outline what information you should take away and really have a good understanding of. There's also a course prototype list. So think about what a prototype is. So have you ever heard the word prototype before? So basically a prototype is like a model, right? And everything else is based off of that model. In this course, it's a lead agent or generic drug in a drug class that represents the class, okay? So if you get out your prototype list and go to the central nervous system, note that there's a class for analgesics. There's also a subclass for opioid agonists, and then the prototype on there is called morphine sulfate. So that means in this course, for opioid analgesics, the drug that we're going to be learning is morphine sulfate. Okay. Keep in mind, though, do you think that's the only drug in that entire class that represents opioids? The answer would be no. Okay. So other examples of opioid agonists out on the market would be something called Vicodin, Percocet, Dilaudid. Those are all examples. Okay. But we might not talk about them in the class, but if you understand what the drug class is, when you find those drugs out in your practice, you'll have an understanding of what they are. So another thing I just want to point out on the prototype list is that the prototype drugs are listed in their generic name, and the trade name is in parentheses behind them. So if you look at the prototype list under central nervous system for acetaminophen, that is a generic name of a drug, okay? Tylenol is the trade name. Okay, so we have you learn the generic names because that's how the NCLEX boards are going to test you. Okay, typically on exams, I'll have the generic name with the trade name in parentheses behind it. So why do you think it's also important to know the trade names? Well, this could be because physicians often will give you an order out in practice and just list the trade name, right? So they might not actually say the generic name, so you do have to have an understanding of both. So course assignments, make sure you guys are checking the learning management system frequently. This is where assignments will be listed in each lesson. So Each week there will be different lessons for you to open, and in those lessons will be the lecture PowerPoint, different other activities that may be included, and other resources. So examples of assignments that you could find would be maybe online quiz links that need to be completed within certain dates, worksheets that need to be completed before class. Sometimes they will just also have maybe a worksheet listed that says print and bring to class, but doesn't need to be done. So make sure you read all of that information closely so you know what is specifically expected of you. So how can you study for this course? That's probably one of the big questions you all have. Quizzing yourself frequently is a very effective study strategy. So you could create quiz questions based off of the course objectives. And view the NCLEX questions at the end of chapters to just really start to understand how NCLEX questions are written, okay? Because they're not like your traditional, tell me what is this, okay? Really, NCLEX questions want you to start thinking more critically about information. Another study technique would be concept maps. I do have examples included in the overview lesson of things you need to prepare for before coming to class. I also recommend that you limit flashcards. If you use flashcards, these usually don't help with long-term retention. Okay, so we do have a cumulative final at the end of this course, and if you just use flashcards to study, when you get to the week 15 when you're studying, you might not recall all that information. So if you are going to use flashcards, I do recommend that you write them in your own words and try to write them in the form of a question. There's another technique called the 3-box technique. So if you are going to be writing down flashcards or different types of quiz questions on certain content, you can write that down and put that in box 1. And then every other day you want to pull out all those cards that are in box 1 and start to see if you can recall that information. When you've mastered that, go ahead and move it to box 2, which means then you would look at it about once a week. Okay, and then if you've mastered that, you can move it to box 3, where you'd look at it every other week. Okay, but if at any point in time you pull a card out or any information out of box 2 or box 3, and you don't really recall that information, put it back in box 1 so you can master it again. Okay? So why should we study pharmacology? So I really want you to start to consider this question as you prepare to view the upcoming lecture titled Pharmacology Overview, where we'll dig into this a little bit more deeply.